Welcome to our channel where we explore various topics related to healthcare. Today, we'll be delving into the origins of healthcare finance, tracing back its roots to ancient civilizations and how it has evolved over time to become what it is today. Ancient civilizations. When we talk about the origins of healthcare finance, it's important to understand the role that ancient civilizations played in shaping our understanding of healthcare and how it should be funded. In ancient Egypt, for example, healthcare was primarily the responsibility of the pharaohs, who would employ physicians to provide healthcare to their people. These physicians were compensated with food, clothing, and land, and were highly respected members of society. Similarly, in ancient Greece, healthcare was also provided by physicians who were paid directly by the patients they treated. Wealthy individuals would often pay for the healthcare of the poor as part of their civic duty to the community. In ancient Rome, healthcare was provided to soldiers and citizens by the state, which established the first healthcare system in history. The Roman army had its own medical corps, with physicians trained to care for wounded soldiers on the battlefield. In peacetime, the Roman government provided healthcare to its citizens, using funds collected from taxes. Overall, ancient civilizations played an important role in the development of healthcare finance, establishing the basic principles of funding healthcare services through either public or private means. These principles would continue to evolve over time, leading to the complex systems of healthcare finance that we have today. Middle Ages. During the Middle Ages, healthcare was not yet considered a business or an industry. Instead, it was largely provided by the church and charitable organizations, which saw it as a form of charity or good works. Hospitals in the Middle Ages were primarily run by religious orders like the Knights Hospitaller, the Knights of St. John, and the Hospitallers of St. Anthony. These organizations provided basic medical care to the sick and injured, as well as food, shelter, and spiritual guidance. Patients were not required to pay for services, but they were expected to make a donation to the church or charity. The concept of medical fees did exist during this time, but it was reserved for physicians who practiced outside of the hospital setting. Physicians were not commonly trained in medical schools during the Middle Ages, and most learned their trade through an apprenticeship with an experienced practitioner. Physicians who worked in cities and towns would charge fees for their services, which were typically paid by the patient or their family. The fees were negotiated on a case-by-case basis, and the amount varied depending on the patient's social status and ability to pay. In some cases, wealthy patrons would endow a hospital or clinic with funds to pay for the care of the poor. These endowments were often tied to specific religious holidays or anniversaries, and the funds would be used to provide food, medicine, and other basic needs for the sick and injured. Despite these efforts, healthcare during the Middle Ages was often rudimentary and ineffective. There were few effective treatments for most illnesses, and medical knowledge was limited. Many diseases were believed to be caused by supernatural forces like demons or witches, and the treatment of such illnesses often involved prayer, exorcism, or other forms of religious intervention. Overall, healthcare finance during the Middle Ages was focused on charitable giving and the provision of basic medical care. It was not yet seen as a business or industry, and the concept of medical fees was only just beginning to emerge. Modern times. During modern times, healthcare finance has become increasingly complex with the rise of insurance and government-funded healthcare programs. Insurance companies. In the early 1900s, insurance companies began to offer healthcare policies to individuals, primarily for hospitalization and surgery. These policies were known as hospitalization insurance, and were designed to cover the costs associated with a hospital stay or surgical procedure. The cost of these policies was based on the risk of the insured, their age, and their overall health. Over time, insurance policies became more comprehensive, covering a wider range of healthcare services, including doctor visits, prescription drugs, and preventative care. These policies were designed to provide more comprehensive coverage to individuals and families, but they also came with higher premiums and deductibles. Today, insurance companies are a major player in healthcare finance, covering the majority of healthcare costs for individuals and families. However, the rising cost of healthcare has led to increased premiums and deductibles, making it difficult for some individuals and families to afford the coverage they need. Government-funded healthcare. In addition to insurance, governments have also established programs to provide healthcare to citizens. In the United States, the most well-known programs are Medicare and Medicaid. Medicare is a federally funded program that provides healthcare coverage to individuals over the age of 65 and those with certain disabilities. Medicaid, on the other hand, is a joint federal and state program that provides healthcare coverage to low-income individuals and families. These programs are funded through taxes and premiums paid by the insured. Medicare is primarily funded through payroll taxes, while Medicaid is funded by a combination of federal and state funds. Government-funded healthcare programs have played a critical role in ensuring that individuals and families have access to healthcare, regardless of their income or health status. However, these programs are not without their challenges. The rising cost of healthcare has put pressure on these programs, and there is ongoing debate about how to sustain and improve them. Healthcare finance has evolved significantly in modern times, with insurance and government-funded healthcare programs playing a major role in covering healthcare costs. While these programs have made healthcare more accessible and affordable for many individuals and families, the rising cost of healthcare continues to pose challenges. As we look to the future, it will be important to find ways to make healthcare more affordable and sustainable for everyone. In conclusion, healthcare finance has come a long way since its origins in ancient civilizations. Today, it is a complex and important aspect of healthcare, ensuring that patients receive the care they need while healthcare providers are compensated for their services. We hope you enjoyed learning about the origins of healthcare finance. Thanks for watching, and don't forget to subscribe to our channel for more informative videos about healthcare.